healthcare industry decision makers, the World Patient Safety Day theme that focuses on health worker safety is a reminder actually of the responsibility of the healthcare facility management to ensure that resources are allocated for the necessary infrastructure, equipment, supplies, and enabling processes. Viewing patient safety as a result of health worker safety is not only wise, but it is very logical. In fact, we cannot ensure patient safety without establishing safety protocols for the health workers' welfare. The famous phrase, primum non nocere, meaning first, do no harm, which had always referred to the patients, has taken on another perspective actually. It can, after all, be applicable to health workers as well. Our understanding or our education about health worker safety and our appreciation of health worker safety was fast-tracked because of this pandemic. Patients always come first. So there is always that importance given to patients as medical practitioners. So going through the educational system, that's what we were ingrained with.
Right.
That patients come first. Patients are primary. They are the ones that we should be looking after. So everything is centered towards the patient and the welfare of the patient. So much so that health worker safety actually is not very much discussed in the educational setting. That's why if asked that question, I would say that we have to start with the educational system. Yes. And in fact, I would be proposing to our society to look into tapping educational institutions as well and starting them early, starting from the education system, excuse me, so that as they go out of the educational system and become professionals, they know that health worker safety is very important and very much linked to patient safety. So there has to be that strategy. The distress and the emotional disturbances that our health workers are experiencing are rooted on certain thoughts going through their mind. So one is the risk of being exposed to the virus. So the management can alleviate or help in removing this thought of the risk of being exposed to the virus by ensuring that protective measures are in place and that workers are informed about this. So the workers must see and must know and must be informed that these are being done so that they are safe. And some hospitals actually were able to respond quickly and well because of this emergency response system or process that they already have in place. So this is something that actually is a wake-up call for healthcare institutions. IT innovation actually is already changing our healthcare delivery. In fact, it is changing healthcare delivery by, number one, reaching people wherever they are in their journey in healthcare. Number two, identifying when people are at risk and knowing what they need before they need it. And third, by designing personal interventions and deploying them in a timely manner, predictively.